It is a solution for those aches and pains. Sandra's got the feel-good answers for you, Sam.
That's right. So many people suffer from all kinds of body aches and pains, and they're not really sure what it is. When we come back, we've got a treatment we're going to show you. It's wonderful for releasing some of that problems, whether you suffer from fibromyalgia or accident pain. We're going to explain it to you when Good Day continues.
All right, do you suffer from those achy joints and painful limbs?
Sandra Furlong is live at a Modesto clinic, specially trained in treating those kinds of things. Sandra?
That's right, myofascial. You guys have any idea what that is?
No.
All right, well, let's go ahead and ask the expert, Richard Hoff. Tell me, first of all, what's a fascial tissue?
Fascial tissue is that tissue that twists and turns throughout your entire body. You're actually one solid sheet of fascial tissue from the top of your head all the way down to your toes. And if we look at this piece of gauze, we can look at this as a fascial structure. And you actually should be just a relaxed piece of tissue. And a lot of people, this tissue just starts to bind and move, and it gets bound down.
Some of that can happen from just growing and aches and pains
Growing and
moving.
aches, just taking a slip and a fall.
Right, but it could be something as severe as an automobile accident.
Severe as an automobile accident, whiplash. We have people that have fallen on the job. So we see all kinds of different issues that involve the fascial structure. Reflex sympathetic dystrophy, or RSD, fibromyalgia, myofascial pain syndrome. These are all things that change the fascial structure. And the fascial structure is something that should just open and close and move with the system. And what we find is that it's gotten bogged down to the point where it just gets tense and doesn't move. And so what we do with myofascial release is different types of cross-hand release techniques where we sink into the fascial tissue and then remold it, so to speak, so that it then moves with the body and not binding down.
And how does this differ from traditional physical therapy or massage techniques?
Traditional physical therapy and massage techniques have a tendency to work the tissue directly on the surface, where we're actually sinking into the system and allowing it to change its structure. You know, we tell people that we just actually literally sink into the tissue, so it's like clay, and you engage that barrier and you wait for that barrier to move, which could be up to 2 to 3 minutes before that structure actually starts to move, but you're working down into the system.
Now, one of the reasons for the aches and pains and disturbance of the myofascial would be uneven legs.
Right.
You know, you're one's longer than the other.
Right. You can get actually a shift in the pelvis where you can get an anterior rotation or a posterior rotation, which can cause a leg length discrepancy, which can change that whole muscular structure across the front of the body and actually cause the leg to turn up and in, which can cause low back pain, but actually that can go all the way up to the head. Temporomandibular problems, TMJ, clicking and popping in the jaw, headaches, migraines. You know, people, I have a lot of people, we talk to them about headaches. I say, well, gee, my headache just starts right here at the back of my head and it comes right up behind my eyes. The fascial structure is pulling down. You see that head forward position. And so what we're doing is reshifting that tissue and bringing their head back, bringing their posture and aligning it back to where it should be.
All right, when we come back, Nick and Marianne, we've got our patient right here who had been in a car accident about 5 years ago, still suffers from a lot of neck and shoulder pain. We're going to show what the treatment actually is and then give you a phone number so you can come and see Richard.
Very good. My sister still has problems from an accident she was in years ago.
And how many women do you know say they have fibromyalgia?
Yeah,
a lot. So we'll address that when we come back.
All right. Thanks, Sandra.
Good day. I'm Sandra Furlong. It's called myofascial release. It's a treatment that's going to work on your aches and pains.
8:24 now. It's called myofascial treatment, and it is designed to relieve your aches and pains. Sandra Furlong is live at a Modesto clinic with a demonstration now. Sandra?
That's right. We have our patient who was in an automobile accident 5 years ago, and she still suffers from a lot of the pain, Richard. So obviously things weren't addressed early on.
That's correct.
Why don't we go ahead and walk through an analysis of what are her trouble spots?
Okay, what we're going to do is we're going to have her stand here, and you're going to just soften your system for a second. We're going to look at her shoulders to start with, and you can see how her left shoulder is lower than the right. Her body is actually coming down and being compressed down here in the system. There's a change in tone and structure coming down through the sternocleidomastoid, which is this muscle that comes down through here. There's a little excess tone. It's being pulled off this direction. Now, as she turns around, we can also take a look at the scapulas, and we can see winging in the scapulas. Again, there's a lot more tension in the left side. Her head's being pulled forward. This is all tight.
Probably from seatbelt.
Seatbelt. She was in an automobile accident. She was hit at 50 miles an hour. So she went this way into the seat belt and back, and so we've got a whole change to this whole structure. And so that's what we're going to address, is to try and open this up and level her out.
So myofascial release is a treatment that it's essentially putting pressure to force your body to release that tension.
Well, it's not that we want to force it. We're actually going into the system, going into the tissue and waiting for it. We engage the barrier, wait for the barrier to start to soften, and then as it releases, we open up that structure and we stay with it.
Right.
That was what you felt when you were working with me.
Right. Why don't we go ahead and get her on the bed,
Okay.
and in the meantime, I'm going to talk to the physical therapist here. And how does this work into a full treatment plan for somebody?
Well, typically in physical therapy, they want to address musculoskeletal issues, and a lot of times the fascial component is neglected. So in the case of myofascial release, it's looking at the biomechanical model in a lot of the ways that Rich just did, standing and looking at mechanics and the way the person is posturing and positioning, and then looking at the fascial component and how that plays a role in what's happening with the patient. And so we look at it that way, and then we address what we find as far as fascial restrictions are concerned.
What are you doing right now, Richard?
We're doing what's called a cross-hand release, and Lisa's going to come over and actually pull on her left leg there, and she's going to give me a little leg pull, and we're going to create some tension through the system here and open up through that hip where we were talking about it being kind of bunched together down there in that area, so that we can create some opening in the structure.
How long will the treatment take?
We work on what we call a professional hour, so we spend between 50 and 55 minutes in treatment. We start with an evaluation. We stand our patients up, just like you saw a few moments ago. We spend quite a bit more time in that, especially the first evaluation. Now you can see that we're getting some nice change here, and you can see my hands are moving, and everybody says, well, your hands are slipping, and it's not that my hands are slipping, they're actually in the system, and we're moving the tissue structure itself.
All right, we got to give you a phone number to the Myofascial Release Treatment Center of Modesto. Go ahead and give them a phone call, because you will be amazed at all the different ailments that they treat. And a lot of people will think that the aches and pains are just from, they're sitting wrong in their chair, or maybe they're not exercising enough. But the point is, get it diagnosed by a professional and then come in, and your life will be much easier. How do you feel?
I feel great.
There we go. In the words of an accident victim from 5 years ago, and she's still feeling some of that pain. Marianne?
All right, yeah, thanks, Sandra.